investigated.
Okay. Alright. Alright, very good.
Alerted surgical team, they are on the way.
Alright, very good. So now we already released. The heart sound just now was normal, right? You're saying? No muffled sound, right?
Yeah, I will auscultate the lungs again.
Yeah.
How is
After
the
we,
air entry?
after we,
Air entry improved.
okay. Then we did. Let's go down to the circulation lines. Like how's the pulse
How is
volume?
the
How's the
CRT and the
CRT?
pulse volume?
Pulse volume, low pulse volume.
CRT wise, like?
45 seconds.
45 seconds. Okay, guys. Patient is having a third degree shock. Okay, I want you to, the fluids continue to run, Amiza. Up a safe hole. Is the GSM available now, Amiza?
GSM available?
Okay, run the patient's GSM. Alright, like
I
continue.
move on the inspection of the abdomen. Is there any bruises, any hematoma?
I want the...
Is it distended? Alright. On palpation? On palpation of the abdomen? On chest spring? Is it?
Pelvic
chest
spring?
Pelvic spring?
Are we still normal?
Look at the hematoma. Is there
Okay, look down at the scrotum. Is there any blood from the meatus of the scrotum? Is there any hemat?
Negative.
Negative. Alright, let's going down. Okay, Hannah just now already report to me.
Yeah, already...
There is also already a penetrating injury. You already apply a donut in the first spot, right? Compression. Okay, let's continue to move down. Expose back.
Active bleeding from the right side.
Still active bleeding, although we apply bandage. Okay, guys, we need to continue manage this wound well. Okay, can we continue bandage, please? Can we continue bandage?
I'll do the traction.
All right.
I'm doing bandage now. Is there any distant pulses over the DPA?
Yes, present.
Okay, fine.
I apply the traction.
Alright, good.
On the bandage.
Pulse present means patient is still no vascular injury. Okay, bandage apply. More bandage apply, pressure bandage.
Team leader,
How's the bleeding? Yes?
I'm already in the blood.
Alright, very good. Blood has been given by the patient. Okay, now how is the bandage? How is the evening? Answer to me, how is the bandage now?
I'm doing bandage now.
Very
Look,
good.
Blood.
How's the
mati
blood
kurang
condition?
sikit.
Is the blood still coming out in me?
Blood stop.
Blood stop already. Alright, very well done, Ibni.
Team leader, do you think we need to alert auto team?
Yes, but we put in the immobilizer pack first.
Alright, team leader.
Later you go and inform the auto team, alright? Okay, come.
Okay.
Okay, after we done all this procedure, Hamiza, I need you to report me back to the vital sign.
I will
What is
recheck the
BP?
pulse, distant pulse again.
Alright? How's the BP, pulse rate, SpO2, respi rate?
BP 90.
Pulse palpable over the DPA. Apply back the sling.
Okay. Patient improve after all our procedure, right? Okay.
Yes, team leader.
But make sure the blood still ongoing, alright?
Right. Okay, team leader, I clean the patient.
Okay, very good.
I clean the patient.
Alright, check the temperature at all time. Like, have you informed orthopedic team?
Yeah, I call the orthopedic team right now.
Okay, now we have done airway, breathing, circulation. Let's,
Yeah, we have one case, polytrauma just arrived.
guys,
Currently,
let's check the
he having
stability.
a-
I want you to
Alright,
check the
thank you.
patient pupil. Although patient intubated, I want you to check the pupil.
People equal?
Pupil equal. Okay. Alright. But however, just now when patient came in, still not, response is not that great. So we still need to rule out intracranial injury. Later we need to call in the neurosurge team. Alright?
Yes, team
Okay.
leader.
Already done A, B, C, D. We're going to do rock roll. Alright?
Okay. Alright, team leader.
I have to give this patient.
Yeah, you already give. Make sure patient is ATP, antibiotic, phasodinase. Alright? Alright, very good.
Okay, team, we are ready for lock roll.
Yes.
Okay.
Okay, team, position.
Live will perform
I will
the...
perform over the patient right side.
Okay.
Please turn the patient over
Guys,
to the
on
left
which
side.
side? Our chest tube is over.
The right side.
Okay, so
Oh, the
we
right
need
side.
to-
I think
sorry.
you all better come over here. We need to protect the chest tube at all costs. Oh, this one also, yeah, there's a pain injury. Okay, I think in this scenario, left side, someone hold the chest tube.
Yes, I hold the chest tube.
Oh, never mind, you go help, I'll hold the chest tube. Alright? Okay, on your count, Inge,
Okay, team.
chest
We are
tube
ready for
holding.
lock roll.
Okay. Lai, are you ready?
I'm ready, team leader.
Very good.
Okay. On my count, we turn to the my left.
Okay.
1, 2, 3, turn.
Alright.
Is there any abrasion, laceration at the back?
Negative.
Determination at the back?
No.
Step deformity?
No.
Any perineal injury, laceration? No. I proceed with the PR and check for the prostate.
Normal.
Normal. Alright.
Alright, I'm done, team leader.
Alright. What's your finding?
There's no laceration, abrasion wound at the back, no step deformity,
Okay.
and there's no high riding prostate.
Alright.
Okay,
Give
we
me.
put it down. 1, 2, 3, down.
Alright, excellent. Okay. Hannah, I need you to put a CBD for this patient.
Okay, team leader.
I want to see whether patient got blood coming out, myoglobinuria. Alright, report back to me. Okay, now we already did a rock roll, A, B, C, D, E, we're managing. Okay, let's confirm the vital sign again before I send the patient out for x-rays. Hamiza, report back to me. BP, pulse rate, SpO2, respi rate.
Okay, but
BP 95/65.
Okay.
Pass rate 100.
Okay, BP 95/65, pass it 100.
SpO2?
SpO2,
95%.
95%.
Okay. Patient is stable. Okay guys, listen up. This is the next stage of plan. We're going to send the patient for primary x-rays, chest x-ray, pelvic x-ray. Our patient also have open wound, right? We're going to send for the one shot, we're going to send for left femur fractures. In the same time, after we did the primary x-ray, patient still stable, we need to send patient for CD brain and CD cervical. Okay.
Doctor, CBD started.
Very good. Now, I need you all to do post-resuscitation care. With me, take care of the airway, do regular suction, right? Still do an ABG, monitor alliance with the NS, okay?
Okay, Linda, I
You have
do
to-
a suction degree.
You have to do the post-intubation ECG, alright? Monitor the circulation.
Yes,
You
leader.
need to immobilize and then put in the CBD and everything. Make sure patient has IV ranitidine, adequate sedation, alright?
Linda, I see the wound, the head,
Okay.
doing the bandaging.
Okay, live, I need you to perform a secondary survey.
Yes, team leader.
Swab the patient from head to toe. And then you're going to be the liaison officer, liaison with all the team, make sure they come down in time.
Yes, team leader. I'll
Alright.
perform secondary survey.
Secondary survey, make sure the laceration wound is being managed and everything, alright?
Team leader, medication all given as ordered.
Okay, line, report, sorry.
Medication all given as ordered.
What medication have you given? Ranitidine. Very good.
Bleeding over the right ear.
Maybe midamorphine 2 ml per hour has been given. Check. Okay.
Yes.
Facial bone injury.
Okay, Hamiza, tell me the patient diagnostic and temperature. Is patient well kept?
I look at the oral cavity,
Temperature.
any secretion, any fracture lines in.
DST and temperature.
Temperature? Okay. Keep the patient warm at all costs, alright?
Yes, leader.
Deformity over the left upper limb.
Okay, line, where you done the secondary already? Head, okay, line.
There's no facial bone, signs of facial injury.
Okay.
Airway was intact.
Okay.
Left upper limb was normal.
Have you checked the oral cavity? Is there any penetrating injury? Any foreign object inside? You checked already? Nothing.
Body.
Alright. The neck, is there any subcutaneous emphysema developed just now?
No.
No, alright. Breathing part, you recheck back, the chest tube is still lodging there, right? Still functioning, right? Okay. Chest rise still okay, right?
Chest rise.
Alright.
Air entry over both lungs.
Okay.
Alright.
With oral cavity.
I'll recheck
Okay.
the pulse.
Just maintain and ask you. Okay.
CRT. Examine the right upper limb.
Okay. While Dr. Lai doing secondary survey, you're continuing your management of post-resuscitation care.
Alright, leader.
Abdominal
all
palpations.
for you.
Yes.
Blood investigation.
What is the blood investigation that available now?
Pelvic
Is there
spring.
any blood investigation available, Hamida?
I'll check the
Okay, never mind. Once available, report back to me.
Yes, leader.
Okay, Hamiza, I want you to count how many fluid you have been given. Do a strict IO chart now.
Yes,
Make
leader.
sure the patient have adequate urine output, 1 to 2 ml per kg per hour, okay?
Alright, yes, leader. 1 to 2 ml
is the dorsal.
is per hour.
Okay.
How is the distal pulses of the right leg?
Alright, leader. Already given 1 liter.
Okay.
Need to continue.
Immobilization manager, tell me all the wound has been cleaned and
Yes,
irrigated.
yes, team leader. I already cleaned the wound with dressing.
Alright, very good. Make sure patient didn't get secondary infected, okay? Manage the wound.
Linda, I do a regular suction now.
Alright, very good. How's the ABG? Have you taken the ABG?
Okay, if you taken.
Post-intubation ABG? Okay, not ready yet. Never mind. You alliance with the NS. Inform them. Okay. Mr. Bowser. Okay, line.
Leader.
Report. Secondary survey.
Secondary survey all clear. Other than there's only right ear bleed.
Alright.
There's no maxillofacial injuries.
Alright.
Legs are intact. Chest entry bilaterally improving. Chest still functioning well.
Okay. Heart sound.
CRT less than
Still
2
good.
seconds. Heart sound. I haven't checked. I will check again. Team
Okay, you check the
leader.
heart sound. Heart
Oscar, the
sound.
heart sound.
Alright, heart sound good.
Heart sound
Okay.
is good.
Circulation.
Circulation wise, CRT less than 2 seconds. Pulse
Okay.
improving.
Good.
Abdomen is soft, non-tender, pelvic spring negative.
Okay.
There's no more active bleeding from the open wound.
Okay.
Distal pulses, both legs are
Okay.
good at present, and there's no other fracture except for the right leg.
Very good, line. So you have done the second survey. Clean sweat from head to toe.
Team leader, do you think we need to perform with the fast scan?
Yeah. Okay.
I'll bring the ultrasound. Is that
Do the secondary and jump.
ultrasound is here, team leader?
Okay.
I will perform the e-fast,
Very
extended
good.
fast
Do
scan.
the EFAS. Show all the point of EFAS, please.
I'll do at the Morrison pouch, clinorenal angle, and the pelvic regions. subcostal.
Hamiza, how's the
And look at the heart.
post-intubation
Is there any
ECG?
cardiac effusion?
Alright, I'm doing improvement
Profit,
leader.
the lung scan.
Post-intubation ECG.
Still ada ABG record.
Yeah, but now the results is still not available yet. You trace and then inform to NS, okay?
Okey, team leader.
Alright, post-intubation ECG.
Okay.
Team leader, E5 is negative. No, there's no free fluid. Silent sign is absence of the right side.
Understand?
Pneumothorax.
Okay.
Okay. Now we check back all the vital signs. Hamiza, report back to me the vital sign, BP, pulse rate, SpO2 and SP rate.
Alright, okay. The BP for this patient 110/65, pulse rate 100, SpO2 95% under SMV mode,
Okay?
and then the respiratory rate
14.
14. Alright,
Okay.
I already do the ECG post intubation.
Patient is considered hemodynamically stable now. Alright guys, you already do a secondary survey, right?
Already the secondary survey.
Okay, very good. And then now how's the other team? Are they coming down? NS, surgical, orthopedic, alliance with them. Patient, they come. Yes.
You already inserted the CBD? Alright.
Please be fast.
What is the finding of the CBD? Finding of CBD? Is there any blood in the CBD bag? Is there any myoglobin
There's no
pneumonia?
CB, no
Okay.
blood in
No
the
CBD,
urine.
no any.
Okay, manage the CBD. Alright guys, before we do the summary, short summary of
Yes,
this
team
patient.
leader.
Alright?
Okay, team leader.
This is a 30-year-old gentleman, just now involved in a high impact injury, MVA, motorbike versus unknown vehicles. And then he was thrown out very fast, so it's a very high impact. Patient subsequently arrived, airway wasn't protected, having stridor. We tried to open the airway but couldn't get, so we need to intubate the patient. And then we managed to intubate the patient without any issues. So after that, subsequently when we investigate at the breathing part, we found that the patient had right pneumothorax. We did release the tension pneumothorax first, then right pneumothorax. Then we put in a needle and also the chest tube. Subsequently, when we go down the abdomen, we didn't find patient is in shock. We give fluids and blood. And then we go down to lower limb. We found the problem in lower limb. Patient having a penetrating injury, but you well done. You redone the donut and then do the compression by evening and then do the immobilization. That is why the patient become more and more stable hemodynamically. Okay, so now the post-resuscitation care, have you guys done already?
Done, team leader.
Dan dia dia.
Suctioning, ABG, ECG done, sedation given, ranitidine, everything given at CBD, monitor the urine output. Okay, you already alliance with the other team, right?
Yeah, the MO from the surgical, ENS, and also auto, they are on the way.
Okay guys, since we already done the thing, just continue back to your station, make sure everything is well done, and then at the same time, let's send the patient to x-rays, alright? Chest, pelvic, and then CT brain, and also the lower limbs. Alright, is there any problem? If there is problem, please report back to me at all times.
Yes, yes, team leader.
Okay? Alright. Okay. One, this is a 30+ gentleman. Okay, one, this is a 30+ gentleman, just now involved in an MVA, motorbike, and then a very high impact injury. The condition of motorbike was very bad. And then subsequently when the patient arrived, the airway wasn't protected. He's having a stridor. We tried to open the airway. Sorry? We were thinking of this one, airway obstruction for this patient. So we intubated the patient, we get in the NS. Subsequently, the breathing part, there's a tension pneumothorax. We put in a chest tube. Alright. Sorry?
What else did you find?
What else did I find? I find there is a chest right unequal, tension pneumothorax, then become pneumothorax. So I put in the chest tube. Again, in a general surgery. And then at the same time, when I go down to the circulation part, abdomen is not distended, we didn't suspect an intra-abdominal injury. Pelvis was negative. However, the time the BP, although we given fluids and blood, didn't pick up much because there's a wound there on the right. Right, there's a lower limbs. Sorry?
Other finding?
Other finding, there's no blood in the ureter meatus and everything. Then when we go down to the lower limb, the right lower limb, we found a open penetrating injury. My staff already give a donut, compression, immobilization. That's why the PP subsequently improved.
Okay, thank you.
Okay.
Dr. Azrin will ask.
Okay.
Thank you. So the question is, what is lemon?
Sorry?
What is lemon?
Okay.
Law for the basic airway management.
Lemon law is actually look externally. Okay, externally, some patients, they will have some mustache, then you increase your difficulty to intubate, or you generally seeing the patient obese or obesity. And then the E is, there's a measurement, three finger, and then 2 finger. The method, you open up your mouth, use patient's finger, put in if you can open up to 3 finger, it's quite easy to intubate. And then if there's 3 finger down here, it's also quite easy to intubate. But here we must at least have 2 finger. Then subsequently, actually, for a conscious patient, you can open up the mouth. We can see the myopathy score, grade 1, 2, 3, 4. Grade 1, you will see everything. The pillar, the soft palate, hard palate, the fauces. The second one, you don't see the pillar anymore, but you see the soft pillar, you see the soft palate, hard palate, and also the fauces. The third one, you only see partially even the hard palate only. No longer can see the soft palate. The fourth one, you don't see anything. But however, in this patient, we didn't use that one because patient unable to sit up. So we didn't use that method to further assess the patient. And also obstruction. Obstruction, we will try to check whether the neck, whether short neck or not, and then any obstruction. So basically, we apply the Lemon score before the pre-intubation. And one more is neck extension, mobility. Neck mobility will be difficult in this patient because he's a trauma patient. We put on the cervical collar already.
Alright. So the next question is, what is the estimated blood loss in a single long bone fracture?
Single long bone fracture, except like femur, can go very high up, 2 to 3 liter to 4 liter sometimes also. So open fracture some more.
So how much?
I'll put estimation at 4 liter.
4 liter. Alright. Thank you. So the just next time, don't give me clear the
Oh, sorry.
give me the name of the
Higher mental.
Alright.
Okay. Alright, thank you. Alright, team, stand down. We make sure the patient has been well management. Alright, okay, thank you very much.
Thank you, team leader.
Take it on. Anyone?
I've been on.